Welcome to the Dr. Mudgil podcast. I'm so excited to have you here with me. So this is a new year, and this is going to be a new paradigm that we have for the podcast. We're still going to do interviews. I'm still going to be interviewing inspiring folks and hearing compelling stories that inspire us all. But, this past year or so, we've been doing a Thoughts of the Week segment. We've also been doing an Ask Dr. Mudgil series, and all of those posts I love doing, but I realize when I record those posts that sometimes there's so much more that I'd like to say about a particular issue, and it's just tough to do that in like an Instagram post or a very, very short post, which is only a few minutes long. So it actually occurred to me that I have another platform to post longer format stuff and, kind of really dive deep into an issue. And that, of course, is the Dr. Mudgil podcast. So we're in the second week of 2023. This is episode number 60 of the Dr. Mudgil podcast, which is very exciting. It's a exciting milestone for us. And this is going to be essentially like a long Thoughts of the Week. So as I'm sure many of you are aware, particularly many of you folks who live in the New York City area, the nurses at Mount Sinai Medical Center and at Montefiore Medical Center here in New York City went on strike. And they went on strike because they were basically getting effed by the hospital. They were working incredibly long hours. They were underpaid. Nursing is probably the single most important job in a hospital. I remember when I was an intern like 21 years ago. The nurses, especially for us young doctors that were just fresh out of medical school, were an incredible resource for us all. And, they were a wealth of knowledge. They provided amazing care for the patients. And, just as a for instance, when I was in the ICU, in the medical ICU, there was one nurse for every patient because those patients were so sick. There was a nurse for 12 hours a day that knew them inside out. And then there'd be another nurse that came on for the overnight shift, and another 12-hour shift. So it was basically two people taking care of this very, very sick patient, and that really optimized the outcome for these patients. But now, nurses are short-staffed. COVID was just a nightmare for nurses, and, a lot of nurses and doctors left the field of medicine. And now instead of taking care of one ICU patient, nurses were taking care of two ICU patients, maybe four ICU patients on a regular floor instead of taking care of maybe 2 or 4 patients who, are sick but not ICU sick. Nurses were taking care of 8 patients, working a crazy amount of hours, getting underpaid. And, quite frankly, they were fed up with it and they went on strike. Unfortunately, I think it was today that they resolved their issues and, they had their union had a successful negotiation with the hospitals and they're back. But this actually, what happened this week is sort of in the context of a lot of the stuff I've been talking about. And, folks will send me stuff, they'll DM me or text me, just information or tweets or stuff related to just how effed up healthcare is. Like, for instance, someone sent me a tweet by this guy, Robert Ubre. I don't know who that is, who Robert Ubre is, but he's a doctor. And basically he tweeted, we'll show you the tweet in the podcast, but he basically said 3 points. United Healthcare will profit about $22.3 billion this year, which is crazy. United Healthcare is a health insurance provider, as you know, and one that I don't love. 50% of hospitals will lose money this year. 47% of U.S. health workers plan to leave within the next 3 years. That's a huge number. Half of the healthcare force is going to leave in the next 3 years. That is the current state of U.S. healthcare, and it should terrify everyone. Well, it should terrify everyone. So it really got me thinking about, and this is sort of my long thoughts of the week, got me thinking about healthcare and how healthcare is structured here in the U.S. and how there's so many problems with healthcare. And when you think about it, there are basically 4 big parts to the healthcare system. There are the health insurance companies like United Healthcare, Blue Cross Blue Shield, who are the absolute worst companies. Their only motivation is making profit, and I'll get into more of that in a minute. There's big pharma, so the medications that make the pharmaceutical companies that make medications, vaccines, etc. And of course, their primary motivation is maximizing profits, price gouging even for like generic medications. I've seen the cost of medications for some of my patients that were, I'm talking about generic medications that were like $10 last year or like $200 this year Who makes these prices? I have no idea, but the pharmaceutical industry is definitely benefiting from that. Then there's hospital systems. So, huge hospital systems that are gobbling up smaller hospitals and smaller practices. I see that even with the big university hospitals in New York City, like Mount Sinai is expanding, NYU is expanding, Northwell Health is expanding. There are also some private hospital systems throughout the country that are expanding. And then the fourth part are patients and their providers. So that I'm talking about, patients who see a doctor or other healthcare providers, nurse practitioners, PAs, pharmacists. So that's 25% of this four-armed beast. And what ends up happening is the for-profit arms, so there's three of those, health insurance companies, hospital systems, and pharmaceutical companies, are all for profit. And basically are all trying to get a bigger piece of the pie when it comes to healthcare dollars. So health insurance companies, we have talked about many times, F their patients and their providers. Like, we basically all put our money, paying our premiums into this pot. As I mentioned before, I pay nearly $4,000 a month for healthcare coverage for my family. I have a high deductible plan despite doing that, and many of us out there do. And the way health insurance companies make their money is by holding on to that pool of funds that we're pouring into the pot. And the way they do that is by denying patients benefits. So, denying an MRI or denying some specialized test a patient may need or denying a service they may need, like physical therapy. And they do that by denying payments to doctors. So the more of those dollars that they can hold on to, they invest those dollars into whatever the hell they invest in to make money. And United Healthcare was so good at it last year that it made $22.3 billion, which is a staggering figure. So they're clearly, self-motivated and don't give a rat's ass about patients or the doctors that take care of them. Then there's the pharmaceutical companies, and their obviously primary motivation is making as much money as possible. So some of these medications, some of the fancy medications that come out, can cost like tens of thousands of dollars a year for patients. And the way listen, we need pharmaceutical companies to develop the amazing medications that they do, the amazing innovations, in treating cancer and diabetes and all sorts of medical problems. But their research is funded almost 99% of the time by government grants. So we pay taxes. Those taxpayer dollars are allocated to a pharmaceutical company to research such and such disease and develop such and such medicine. And then once that medicine is developed, they basically make an enormous profit by charging like a gazillion dollars for the medication. And moreover, like, I don't know how many Ozempic commercials you've seen, but I seem to see an Ozempic commercial. My son, who's 11, sings the Ozempic song. We see those commercials nonstop. I remember particularly during the pandemic, we were watching CNN, and it was basically on all the time. And my son would just walk around the house singing, "Oh, Ozempic," the Ozempic song, all day long. And every other commercial I realized was for pharmaceutical companies, was some new medication that came out for whatever company it may be. And it made me realize that say there was something that went wrong with one of these medicines, or just say there was a story about how crazy prices are for these medications. There's no incentive for our media to talk about it, because their biggest advertisers, the people that are pouring the most money and keeping their channels, the newspapers, et cetera, keeping them viable, are these pharmaceutical companies. They're in the pockets of our legislators, they're in the pockets of our media sources. So there's very little incentive for folks in power or folks with influence to speak out against them. So that's a big problem. Then hospital-based systems are another huge problem. So there's several key issues here with hospitals. So one is, and there's an article in the New York Times, which we'll show you, which is actually a pretty good article. It came out last month. It basically talks about how a sprawling hospital chain ignited its own staffing crisis during COVID. And what happens is, as hospitals expand, especially private hospital systems, their primary goal, of course, is also to maximize their profits. And the way they do that is by cutting down on staff, right? So staff is cut down Nurses are fired. Many doctors are replaced with like PAs or nurse practitioners to reduce costs. And really what happened, and this was really highlighted during COVID, where, say like hospital systems that were bought in like 2017, 2018, they fired a whole bunch of people to maximize profits. They didn't expect a lot of people to be sick. And then the pandemic hit and they were short staffed. They didn't have enough nurses. They didn't have enough doctors. They didn't have enough, other ancillary staff or other folks that are involved in treating patients to care for them. And it was a shitstorm. And, basically these hospital systems created this perfect storm for failing during the pandemic. So that's one issue with hospital systems. The second issue is hospital administrative staff has become so bloated. In fact, and there's another article which we'll share with you. For every one doctor that's out there, there are 10 administrative staff members. So that's crazy. There are 10 times as many administrative staff members as there are doctors in a hospital. That makes absolutely no sense. It's an incredible waste of resources. Those administrators play no role in the actual administration of care for patients. Their only goal is to somehow work to maximize profits of hospitals, whether it's dealing with billing issues or cutting down staff or, dealing with negotiating supplies. In fact, for every one doctor, there are actually 16 other members of the healthcare team that are involved in the function of the hospital. And only 6 of those folks are actually involved in patient care. So phlebotomists, nurses, medical assistants, pharmacists, etc. The other 10 of those 16 are administrators. I mean, it's a huge suck on the resources of a hospital. And that's why, referring back to that tweet, that's why 50% of hospitals will lose money this year. And, all of this happens. And the third point is actually, in these hospital chains, these massive hospital systems, who, like I said, acquire multiple community hospitals and they'll acquire small practices. Their whole goal is to maximize profits. And one of the ways they do that is they replace MDs with nurse practitioners and PAs. And this is something I actually spoke about in a post. It was actually somewhat of a controversial post where I said, I think the title of the post was PAs and MPs are not MDs. And, I got some pushback from it from like nurses and physicians assistants. But the truth is I stand by that statement because, if say you're a PA or a nurse practitioner and you get really, really sick, or your mom gets really, really sick, or your sibling gets really, really sick, or your spouse gets really, really sick, who are you going to seek to help them? Are you going to seek the best nurse practitioner or PA, or are you going to try to find the best doctor who has the training to help your family member in need? And, it's somewhat of a rhetorical question, but, I think we all know what the answer is there. But the problem with the way healthcare is going now is the smartest kids in college, who some of whom would want to go on to become doctors, are very frequently making the choice not to because they see the writing on the wall. They see how nefarious health insurance companies are. They see how horrible it is working for a hospital-based system whose goal is just literally to maximize profits. They see how horrible the pharmaceutical industry is. And all of this is at the expense of really what's the heart of healthcare. That's the patient-doctor relationship, or the healthcare provider-patient relationship. And the people that suffer from all of this, bloating in the hospitals and price gouging from pharmaceutical companies, and just, God, I can list 20 things that health insurance companies do that are to the detriment of patients and doctors. But, that's who suffers. I think, and I've said this many times in many of my posts, the folks that are going to make change and the folks that are going to make a difference are us, patients, doctors. We all need to be as vocal as possible to, stop this shitstorm of what's going on in healthcare. if we don't speak up, and really, patients are very vocal, and I think patients need to be more vocal, but doctors really need to be a lot more vocal because, all of us need to work together really to enact change. So that's what's been on my mind this week. Healthcare is in shambles, and really it's up to the end users, us, doctors and patients, to be as vocal as possible so we can enact some change. So with that, we're going to close out this podcast. Let's get it.